Hey Vivalifers, it's Dr. Kelly OMD. We are back for another 5 minutes of health and fitness. So today what we're going to talk about is how traumas can affect our health. So we kind of chalk things up to stress being the reason why we have bad health outcomes. Well, let's think about the traumas that we experience, and this being Minority Health Month, Minority Health and Awareness Month, we want to talk about those traumas. We want to talk about the overt and covert racism, discrimination, as well as unfairness of the playing field, inequities, and not having equality, and how that affects us in each of our lives. And it does not matter whether you are Caucasian, Black, Asian, Hispanic, Native American, we all deal with traumas, but we all know that there are certain races or ethnicities that deal with more trauma in their lives. And what we do is we internalize that. And when we internalize that, that affects our health. And that affects our health in the ways of we see our blood pressure is higher. We see that we are not able to manage our glucose levels, so our sugar levels, so we have diabetes. We see that we're obese because we're utilizing food and alcohol to heal our wounds, which we know that will not heal our wounds. So it is very important that we recognize the traumas, the micro traumas and the macro traumas that we deal with every day. I know we talk about domestic violence and sexual assault as big traumas, but there are small traumas that you may be dealing with on a daily basis that you are internalizing, and it's coming out in your blood pressure levels, your cholesterol, your glucose levels, and in your abdomen. So your body is physically showing you by having migraine headaches, by having obesity, by having heart problems, that it is hurting. And the reason why Vivalife Health Hub is here is because we have doctors and fitness leaders and dietitians to help you manage these micro and macro traumas so that we can have better lives and healthier lives. So on your 5 minutes of health and fitness, identify what your small traumas are on a daily basis, and maybe some of the macro traumas that you have dealt with from your childhood even up into your everyday life. And when we can manage those, and when we find counselors and physicians and practitioners and fitness leaders and nutritionists that can help us through these things, we will find that not only will our numbers look better, the weight will come off, as well as we will feel physically, mentally, and spiritually improved and better each and every day. So let's go and get into our 5 minutes of fitness. Now remember, I'm at the end of my workout for the day, and I'm just giving you a couple of tools that you can use. But if you want longer fitness experiences for free, then go onto YouTube, look up Pop Sugar Fitness. I also look at something called Brittany Babe on Instagram or Facebook, and you will find an opportunity for you to have longer fitness experiences. So let's get into it. One of the moves that I like to do, as you all know, my upper body is pretty strong, or at least looks pretty strong, but I'm always working on that, as well as my lower body. So I like to utilize something that gives me, will work out both of my upper body and my core, and a lot of times your lower back and thighs as well. So we're just going to do a simple push-up. So you can do the easy, moderate, or more difficult ways. The easier ways, and the reason why I have these barbells here or dumbbells here is because when we get into more moderate things, I utilize them. Easiest way is just to be on your knees or your thighs and do a push-up. You can also come up on your knees, which I know some people have some knee issues. Do the same thing. And if you really want to get into it, you lift your hands all the way up and make sure your body comes out with it. So lift your hands off the ground, body up. Good. Of course, the traditional push-up. And then one of the push-ups I like to add, just to give me a full back, shoulder, arm workout, is an elevated push-up. Very good. You do each one of those for 60 seconds, do 3 rounds, and you have a set. So remember, we have micro and macro traumas. We need to address those through counseling, utilizing our professional medical providers, as well as meditation and mindfulness, and most importantly, nutrition and exercise. So I hope you have a wonderful day, and don't forget to do what? Viva life. Bye.